Now, ladies and gentlemen, as you can see, we're changing the stage setup because really we're ensuring that we entertain you with a whole range of subject matters, but also a different format for each session as well. We've had fireside, we've had panel discussions, we've had presentations to kick off the day, and now we've got a TED Talk from a very influential gentleman who really is at the forefront of cutting-edge medical innovations, and I have to say, having followed him, he's a really brilliant person in sharing the knowledge as well. Here at Arab Health M42, we're delighted to have our main stage for the first year here, and the whole idea is that we want to make the knowledge that our experts have accessible to as wide an audience as possible. The next gentleman is doing that every single day, both in his work and in the content that he's sharing. Please do follow him. Without further ado, allow me to please introduce a subject matter: unveiling the future of heart health, how innovation reshapes cardiovascular care. And to take us through this, we have Dr. Yazan Al-Jabri, who is a cardiac surgeon and an assistant professor. I was going to promote you to just a professor there. We're going to promote him on stage. Cleveland Clinic, Abu Dhabi. Please do big him a big round of applause. Thank you, Dr. Yazan. The stage is yours.
Thank you so much. Okay, the mic is working. Assalamu alaikum and good afternoon, everyone. I'm glad to be here. And our topic today is going to be about adopting the latest innovations in cardiovascular health. But before I start, I'd like to ask each one of you to raise your hand if you or any of your loved ones is suffering from a health condition or is currently a patient. And I see a number of hands here. Thank you. When we talk about patients, we tend to refer to them sometimes as strangers, as people that we are trying to help, forgetting the fact that we ourselves are either current patients now or potential patients. What decides that is our genes, the environment, and the choices we make. I stand before you today, not just as a cardiac surgeon, but as a witness to the revolution and the advancements we have seen in healthcare in the past decade. Let us begin the journey with a remarkable patient story. Imagine if you were a 35-year-old gentleman having a good life, newly married, recently welcomed a baby, and you're living what so many people would call a dream life here in Dubai. Life was good until it wasn't. One day, this patient started experiencing swallowing difficulties. At the beginning, most of us would say this is just a thing that will pass by, a sore throat or something like that, but it started getting worse by the day. He started going to doctors who prescribed medications, but his case was getting worse by the day. 2 months down the road, this patient was having so many difficulties that even drinking water was a challenge for him. It was only then that the doctors decided to do a CT scan. And there it was, a shocking surprise. This patient had an aneurysm. And that's a birth defect that deflects the route of his major artery coming out of the heart, called the aorta. And instead of going to the left, like we see here in red, in his case, his aorta was going to the right side. And this caused so much turbulence that with time, his aorta started ballooning and getting bigger and bigger by the day, until it caused what we call a mass effect. It started compressing all the neighboring structures, one of which was the esophagus, the tube that connects the mouth to the stomach. And that was obviously the reason for his difficulty swallowing. But that was the smallest problem. The danger lied in the fact that this aneurysm, just like a balloon, The bigger it gets, the thinner the wall, and the higher the risk for it to rupture. So this was what we can call a ticking bomb. Anytime, this aneurysm could rupture, and that would lead to his death in only a few minutes. He started going to major centers, asking for help, but unfortunately, he got rejected. The case was too complex and too advanced for anyone to help him. Desperate enough, he started sending out emails and doing online consultations, and that was how he reached out to us. We knew the case was rare, was complex. We've never seen anything like this before, but we knew as well that we may be his only chance for survival. And confident in our skills, in our team, we accepted the challenge. We asked the patient to come over, and we were ready to face that. We repeated the imaging, and we held a multidisciplinary team meeting where the cardiac surgeon sat together with the vascular surgeons, the ICU doctors, and the anesthesiologists, all on the same table, looking for an answer and looking for a solution for that patient. But we knew that the solution has to be beyond conventional methods. And that's where it struck us. Okay, we have a CT scan, and it's showing us the problem. We can go with that CT scan to the surgery, but how can we make things easier? How can we make it safer for us? And as we know, this is usually how a CT scan looks. It's in black and white, and it is actually the standard of care at the moment for most of our surgeries. We reached out to our colleagues in New York University, Abu Dhabi, and they were ready and eager to help. And that's where we converted this plain CT scan with the help of artificial intelligence into a 3D sliced model, and from there into a 3D configuration where we are able to isolate organs separately. And as we see here, the heart and the aorta. This is our main focus. And from there, we asked them to print it out into a 3D model. And let me tell you, holding this in my hand, you can't believe how invaluable this was. Instead of going blind into the operating room and facing a rare disease that we have never seen before and taking the risks of the distorted anatomy because of that defect, we were able to hold this in our hands, simulate the surgery, look and tackle every challenge needed to get to that aneurysm, which you can see here, and then take precise measurements and know exactly the steps we need to take in that surgery, making it not just easier for us and safer for the patient, but also shortens the length of time needed to do that and perform that surgery. And as we know, time in that surgery is extremely critical. The longer it takes, the more the chance of complications, and the longer the patient is going to require to recover. I'm glad to share with you that the surgery was a resounding success. The patient was able to go back home after less than a week. And in his last visit, which is a month later, the patient was living his life as if nothing has happened. He was enjoying a healthy lifestyle and his new baby and living his life minute by minute. And that's something we're very proud of. Now, moving on, I would say he was really lucky to be here in the United Arab Emirates, where we have the privilege to access cutting-edge technologies, and we have all the support needed in case of similar conditions. And now we move from the operating rooms to the realm of the digital world. Remote patient monitoring, something we hear every now and then. But let me ask you this. If you were a patient suffering from a serious health condition, admitted to the hospital, and received the treatment needed, and today is the day you have to go home, what would be your biggest worry? It is often the fear of the unknown. What if something happens at home? I'm non-medic. How do I know I'm doing well? How do I know I'm deteriorating? This is the question that we always hear every day when we are about to discharge a patient after a serious condition. And our answer is usually you can reach out to us, or if you feel the deterioration, just come back. But envision this. What if I can send you home with a tiny device, such as this one here? You can just stick it to your body, and this device will send live data to a command center where nurses, qualified nurses, are sitting there 24/7 watching over you, watching over your vitals, and knowing the deterioration even before you as a patient can feel it. This is not merely monitoring, this is proactive care at its finest. And the benefits are unbelievable. We will be able to detect subclinical deterioration, provide timely intervention if needed, and reduce the rates of admission and the rate of complications. And ultimately, saving patients' lives. And this is what we're about. And I am a strong believer that AI is going to transform every aspect of our life when utilized correctly to the better. And for those who know me, they know that I am a wearable enthusiast myself. I always have my smartwatch, the smart ring, sometimes the continuous glucose monitoring, because I believe in this technology. And I believe that this will help us as healthy individuals, as well as when we become patients. And you can't believe a simple device, as simple as a smartwatch, can actually save lives. We have patients coming to our clinics telling us that their smartwatch alarmed them that they have an irregular heartbeat, or what we call an atrial fibrillation. And do you know how they could have otherwise presented to us? And this is what we still see in the emergency department. The fear of an atrial fibrillation is that it can form a small clot inside your heart. And this blood clot, as soon as it has the chance, will embolize and cause a stroke in your brain. And that is usually the first presentation of those patients with atrial fibrillation. So we can say, and that's what I also recommend my patients, to always get a smartwatch and keep it with them. If they feel there is any problems with their heartbeat, they just press the ECG and it can diagnose that for them. Again, the smart ring. It has transformed a lot of my life as I know it. My sleep has changed. It tells me how many times I move during sleep, which side do I sleep on better. It tells me when to drink caffeinated beverages and when not. And it has programmed itself with the help of artificial intelligence on my body and on my heart rate and vitals. So let's not underestimate this. This is going to be the future, and this will help us both as patients and as healthy individuals. Now, moving forward, how do you see the future of healthcare? I believe that in the future, the healthcare is at crossroads, where artificial intelligence, innovations, and genomics converge and meet. And the approach that we have been using until now, the one-size-fits-all, this medication for that disease, will slowly fade into a more personalized medicine. A medicine where treatment plans are going to be tailored to genetic profiles, providing better care, better outcome, and safer for our patients. So this is not far-fetched, by the way. If we think about it, M42, together with DOH, have already partnered together, and they are bringing all of these technologies and advancements home here in the United Arab Emirates. But before I conclude, I want to leave you with this thought-provoking statistic. Do you know that for the first time in 2 centuries, researchers have found that our kids may not live as long as we will? That the average life expectancy has peaked at the year 2014 and has been declining since then. And if you ask me why, they say it's because of the unhealthy lifestyle and because of the higher rates of obesity. And we have to do something about it. Now, in conclusion, I leave you with this statement that together and with the tools we have to make sure that the future of a longer, healthier life is ensured for not just us, but for our children. Thank you so much. Thank you. And let's see where the presenter is.
Dr. Yazan, thank you so much for a very insightful presentation. Now, I'm always quite selfish and ask all the questions myself, but on this occasion, let's open it up to our audience, a very enthusiastic and smiling audience, which I always love. Great. Questions for Dr. Yazan. Please don't be shy. Ah, there is a lady. Fantastic. I love it. Introduce yourself and please ask your question.
Hi, my name is Alal Khatib. I just want to say thank you.
Mic all the way up.
Oh,
yes.
Is it better now?
Yes.
Yeah? Okay. Thank you so much for a very interesting and inspiring talk and for restoring our hope and hopefully increasing the life expectancy of our children in the future with the help of AI.
I hope so too. We have to work on that.
So based on everything you said, AI has clearly shown a lot of promising potential in the healthcare industry, whether it's in diagnosis or treatment of patients. To what extent do you think AI would replace some of the medical professions in the healthcare industry in the future?
A good question. Thank you. Thank you for asking that. Now, again, I really believe that AI is going to transform almost every aspect in our lives, not just healthcare. And the real question would be not AI versus human. I think it will be that human equipped with AI capabilities versus those who don't. So I think we have the chance to embrace that, learn AI, and use it to our benefit, facing the future, and hopefully improving the outcomes and the future of healthcare.
Fantastic. Do you feel like that answered the question in terms of alleviating some of the fear? And I think, Dr. Yazan, you touch on a very astute point there. This idea that technology, it really is unfolding in a way that is uncontrollable, and we must be embracing it and having this positive growth mindset. You share a lot of this in the work that you share online as well. How can we follow your work online?
Well, it's very simple. I have put on my Instagram and I'm actually a health influencer as well. On Instagram, I try to share the awareness and help people understand more about their health problems. I try to be as basic and as close to the people as possible in the topics I raise, using some graphics and informatics as well. The feedback I'm getting until now is amazing. I try to help people through their home and guide them at least where to seek the best possible treatment. And I am a strong believer that there is no better place to seek treatment other than the Cleveland Clinic, Abu Dhabi. Not because I work there.
You have an enthusiastic colleague who agrees with you.
I think the approach we have, I've never seen that approach before, where all doctors sit on the same table sharing ideas and discussing each patient separately.
And I have to say, I've never seen the approach of you bringing in a prop like this. So as you said, this revolutionized what you were doing day to day, and also in conveying the very complex information in a more accessible fashion, which is what you do.
Definitely, definitely. Like, this was just a beginning, and I'm sure we have decided in the future that most of our complex surgeries are going to go into a 3D printer. We're going to simulate the surgeries beforehand because of the very good experience we had with that patient.
Absolutely. And as we've got a few more minutes on the clock, and we have you here with us, Dr. Yazan, you've taken the time out to be here, representing everything that Cleveland Clinic Abu Dhabi are achieving, and this wonderful collaboration on a stage like this with M42.
True.
Here we are at the nexus of technology, sustainability, and health. And how important is it for us to think about health in this very holistic way?
Well, unfortunately, we always say that you only think about health when it's too late, when you become a patient. And that's why my first question was to you that don't wait until you become a patient, but let's be more proactive. Let's try to change our lifestyles, and with the help of these smart wearables, they can actually guide us to the right track, and with the right counseling and with the right doctors, we can try at least, I wouldn't say maybe prevent the disease from happening, but at least push it forward and make it as far as possible.
And I believe a stage like this here at Arab Health is a fantastic way for us to demystify some of the pseudoscience that is out there. You yourself
It's
are an
unbelievable.
experienced
You've
medical
hit the right
professional.
point. You've
Yes.
hit the right point over there. Like in the world we live in today, most of the patients get their information, unfortunately, not even from Google anymore. It's from the social media and from WhatsApp groups. So all the questions I get constantly are based on no facts. They just heard a doctor talking about this or a nutritionist that has recommended them to stop the medication and move to something more herbal. And always, if we have a minute, I like to share a story with you guys.
We do.
I had a patient with heart failure and hypertension coming to my clinic telling me that he stopped all his medication. Why? Because there was a doctor online telling him that he can replace his medication with garlic. So what he started doing is actually taking 2 cloves of garlic in the morning and 2 at night instead of taking his hypertension and heart failure medication. So you know, these patients, facing them is not easy. You can't just tell them this is nonsense, don't do that. So I told them, let's do an experiment together. I sent him home on that regime with the garlic and with a 24-hour blood pressure monitor. So I thought, okay, if garlic works for him, maybe we'll change all the patients to garlic instead of this expensive medication. When he came back after a week, I looked at the readings, and surprisingly, his blood pressure was around 160, 170 usually, and every time he took the garlic, it dropped to 120, 125. But this was only for a single hour. So after an hour, his blood pressure started going up again, and he spent the rest of his day, the 12 hours, with 150, 160 blood pressure. At night, the exact same thing. He took the garlic, and then his blood pressure drops, and that's where he usually took his measurements. So when I showed him these readings, he was totally convinced. And he told me, okay, now I believe in that. And I told him, so you're left now with 2 choices. Either take 2 cloves of garlic every hour for the rest of the day, waking up at night and taking it hourly basis, or just take this 1 tablet once a day. And it's not just gonna drop your blood pressure, it's gonna remodel your heart and hopefully improve your heart failure symptoms. And that was the only time that patient actually listened, and I hope from that time he became an ambassador for that statement.
Absolutely. And I think certainly hearing your experience there and hearing you share those stories, it's certainly confirmed for us that you are an ambassador of sharing not only cutting edge medical innovations, but also sharing the actual truth, which will demystify a lot of the pseudosciences out there. We are so pleased that you were here on the stage. I think this is only the start of a very beautiful relationship with M42. We'll definitely have you back. Dr. Yazan, please do, ladies and gentlemen, give him a huge round of applause.
Thank you. Thank you so much. 2024, inshallah, is going to be a perfect year
Inshallah.
for everyone.
Inshallah. We'll take a photograph before we leave the stage.
Sure.
To commemorate the moment. I may ask you to
With the
hold your
model?
crop. Yes, absolutely.